Okay, so today we're going to demonstrate how to do CPR on your dog, and hopefully it's something that you'll never need to do, but it's a good skill to have should you need it. The first thing to remember is ABC, A being airway, B breathing, C circulation. So if you were to find your dog unconscious, the first thing that you would want to do is to check its airway. So open the mouth, pull his tongue forward, have a look inside the airway, and if there is anything there that's obstructing, use a hooked finger to sweep out the airway, just making sure that you're not going to push anything further down. B is for breathing. So we're going to look at the chest to see if we can see any movement and any breaths. When we do artificial respiration in a dog, it is not the same as a person, and we actually do mouth to snout respiration as opposed to mouth to mouth. And to do that, you would just need to wrap your hands around your dog's muzzle to create a seal, and then you would put your mouth over the nostrils and blow quickly in 1 second breaths. So C is for circulation. So we need to establish whether this dog has got a heartbeat. So to do this, you can move the foreleg backwards onto the chest, and as a rule of thumb, where the elbow meets the chest, the heart normally lies below it. Another place to check for circulation is a pulse, and the best pulse to find on your dog is the femoral pulse. This normally lies underneath the thigh, midway, and you can use 2 fingers, and you should feel a recess, and within that recess lies the femoral artery. It lies quite close to the skin, and this is where you can normally find a good pulse rate. So if you practice this at home on your dog, and you'll get used to feeling it, and then it is better to do that than in an emergency situation where you might be a little bit unsure. I'm going to explain how to give cardiac compressions to your dog. Not all dogs are the same, and as a rule of thumb, if you have a big dog, so like a golden retriever or a Labrador or a German Shepherd, we generally tend to advise that you compress the chest at the widest part, so a little bit back from the heart. If you have a keel-shaped dog with a keel-shaped chest, so a narrow and deep chest like a greyhound or lurcher, the best place to do your compressions is over the heart. If you have a barrel-chested dog like a bulldog, the best place to do the compressions is by turning your dog onto its back and compressing the chest like you would do a human. If you have a very small dog or cat, it's sometimes better to actually wrap your hand around the entire chest and use your thumb, placing your hand at the back of the chest to squeeze. Okay, so to give cardiac compressions to your dog, you need to raise yourself up a little higher than the dog. I would expect you normally to be on the floor and kneeling behind it. You need to lock your elbows and place one hand on top of the other. You need to deliver quite deep compressions, about half the width of the chest, and remember to remove your hand from the chest between each compression, and this allows full recoil of the chest wall. One mistake sometimes people make is that they lean on the dog and they don't take their hands off the chest between compressions. You get much better results if you can remember to lock your elbows and remove your hands after each compression. We normally compress 120 compressions per minute, 30 compressions to 2 breaths, and we repeat that 8 times, or in a cycle of 2 uninterrupted minutes. Okay, so let's put it all together and see how it works in action. So you found your dog lying on the floor, it's unconscious. The first thing you're going to do is to check its airway. So open the mouth, pull the tongue forward, look inside, and sweep with a hooked finger, so you're not going to push anything further down the airway. You're going to check for breathing to see if there's any movement of the chest, and then circulation. Can you feel a heartbeat, and can you feel a pulse rate? And then we're going to start cardiac compressions. So lock your elbows, put one hand on top of the other. We're going to compress for 120 compressions a minute. That's a ratio of 30 compressions to 2 breaths. We're going to compress quite deeply and remove the hands after each compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. So I hope that's been useful.